Hey everybody, it's Dr. Hammerstedt from Holist. I am here to introduce you to the Mindful MD mom, Dr. Nadia Sabri. She is a Texas pediatrician, yogi, mama, artist, and a blogger. I love having my fellow female physician entrepreneurs on here and on my mama docs because we are all doing really super interesting things. And while we're getting her on here to talk about mindfulness in medicine and parenting and how it can really change the rest of your life, let's talk about mindfulness with your food. So Holist Weight Wellness Program, it has mindset coaching, it has weight science coaching, we've got documents, podcasts, we learn all about hormones and how to get rid of the shame around what we think is the willpower issues with food, when in fact it's what you eat and when you eat, and it is hormonal. And so glucose, glycogen, hunger, leptin, we're going to get through all of how to interpret those sensations and how to make good choices, not as a diet, but as the rest of your life. And so I think Dr. Sabri is here, and I'm going to bring you on camera. So, as you can see here, I was trying to write on here like the Mindful MD and Holist and like do all these really fun things with all these markers, and I realized that you have to have the phone forward this way, and so it was all backwards. So kind of ignore that while we're getting her on here. So I'm sure you guys have seen me put on or repost a bunch of Dr. Nadia's blog posts. They're really awesome, and I want you to go check that out as soon as you're done watching us. She has a mindfulness and yoga section. She has a parenting section. She has a medicine section. So there's a little bit for everybody there. And I really like this style and like the non-judgmental manner that she really talks about in all of her posts. And so please check that out. The weight wellness program that we have a hypnotherapist, a meditation guide, and a life coach to add on to your weight science coach. So this is a real serious, engaging, educational, and life transforming event. Let me see. So I shows no answer. Let's try again. What else?
Hello, we're on.
Yes.
Hey, Heather.
I was just about to be like, and I'm still talking.
Yes. No, I don't know what was going on, but
well, we figured it out. It's always learning. So welcome. And so tell us a little bit about you.
Well, thank you so much for having me here, Heather. So I am Dr. Nadia. I'm a board certified pediatrician, a mom of two, and a yogi. So thank you for that great introduction.
Yes.
After becoming a parent, the need for life-work balance was just so much more important to me. I noticed, there's so many more responsibilities, but not enough time to get it all done. So I needed a better kind of way to do it. I needed to fix my perspective on how to handle those demands. And I wasn't alone in this. In fact, a lot of other parents were having the exact same questions, the exact same thoughts, like, how do we do it all? There just seems like there's not enough time. So with that in mind, I started the Mindful MD Mom as a way to discuss these topics that are pertinent to modern millennial parents. So these topics include positive parenting, mindfulness, living an authentic life as parents, work-life balance, self-care, and helping our kids also stay healthy and happy. And of course, with the focus being on wellness, both for the parents and for the children as well.
Yeah,
so,
I mean, you can't, what is the term? You can't fill someone else's cup if yours is empty, right? And our kids learn from us. Just by
absolutely, they're little
them.
sponges. They're always like watching. They're watching and absorbing everything that we're doing. So if we don't have our own stuff in order, that kind of spills onto everything and everyone around us. Yeah. So that's kind of how my blog started. It started as a way to share my experiences as a mom, as a doctor, as a yogi. And I hope by doing this, I'm able to empower others to find balance in their lives as well through mindful living, conscious parenting, and also holistic wellness.
I love that. So, obviously as parents, we need this. And I love that you're a pediatrician who's able to talk about all of this because it is authentic. It feels like really important to be having a child specialist be the one that tell you that it's not only important to take care of your children, but it's important to take care of yourself, which we often forget. But I also love that you're, just a doctor, right? I mean, we need this in medicine. We need this to take better care of our patients. If we're not taking care of ourselves, how are we supposed to do that?
Oh, absolutely. It goes through every single aspect of our lives. And we forget that beyond just being a doctor or beyond just being a parent or whatever our role is, we are still human. And so the best part of this mindfulness movement is that it helps us be better at every aspect of us, which is great.
Yeah. Oh, you've got a shout out here from Terry. Hi, Terry.
Oh, hey, Terry. Thanks for joining us here today. Through all the technical issues.
So I have seen that your blog is like one of the top millennial mom blogs and one of the top yoga. Is it what is it? The other one? It was the top.
Yeah, it's a top mindfulness.
Mindfulness. I love that. Great.
Yeah, thank you.
So tell us a little bit about give us some examples of things that you wish that that you want to like have all of your patients' parents be working with their kids in terms of kids' mindfulness, but also their own mindfulness.
Absolutely, and that's a great question. You know, a lot of times I see in my practice at work, parents are so hard on themselves. Like they're so kind to everybody else around them, but they forget, and so they're so harsh on themselves. They feel like they're failing as a mom or as a dad. So the one thing that I like to always tell my parents is, you're doing a good job. You're doing the best you can. This is a learning experience. You know, I'm doing it too, even though I'm my medical, you too. I mean, medical degree, but parenting, it's a whole nother thing. You don't know about it until you're in it. So the first thing I say, sorry, go ahead. Yeah, go ahead.
And every child is different.
Oh, absolutely. There is no, this is my little note sheet, but there's no guidebook. You know, there's some general rules. So I think what makes my blog a little bit offers a unique perspective is that I don't try to give people just, hey, here's what you should do. Follow my rules and you'll know. It's more just like a perspective on how to kind of look inside yourself and figure out who you are and how to approach your own children with that and help them tap into their own potential as individuals, because everyone's different. No one is the same.
Yeah. It's sort of like I just had this thought, starting your own business and doing all these things that I'm trying to figure out a whole new world, and been thinking a lot about kind of like how I approach business is sort of like figuring out what my business brand is, and parenting is sort of the same thing, right? It's like figuring out how is it that I want to present myself to my children. How is it that what are the kind of the three kind of pillars of things that I know are essential for me to be kind of play acting until you get it, right? Until it's real. Fake it till you make it, right?
Right. Right. Yeah. But it's important to think about all that before you start it, right? You can't just, hopefully you're not just doing something haphazard. You want to kind of think a little bit about, what it is that you want to do. So I think it's great that you're taking the time to think that for your business and applying that to parenting. Because I guess it is like a brand of parenting, and everybody brings their own take into it.
Yeah. So tell us a little bit about mindfulness in medicine and what we can take away from that, whether we're physicians or nurses or some sort of other advanced practice provider that really works with patients. There's so much giving involved with taking care of other people, whether they're your little people or whether you're their patients.
Yeah, absolutely. So first of all, let's back up a little bit and just kind of talk about what is mindfulness. Yeah. It seems like a hot topic, a big buzzword, but not everybody, maybe they don't know what that is. So the first thing is to talk about the definition. So mindfulness, it's a way, and I'm going to actually quote it, so I'm going to read off this, but it's in the words of John Kabat-Zinn, who is basically the leader of the mindfulness movement in modern day, but it's paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. This kind of attention nurtures greater awareness, clarity, and acceptance of the present moment reality. So end quote. So basically in staying with the present, we end up sharing our self-compassion to our thoughts and feelings about something, accepting it, and able to kind of move beyond just our emotions. So we're not letting our emotions control. So in medicine, this is so important because we're dealt with so many hard things, right? People are bringing their most innermost feelings, their own thoughts, judgments, biases, and they want you to solve something. So mindfulness is like, no one is trying to give somebody an answer per se. You're basically doing a team approach to help the person and you together. So it brings more compassion to the to the experience. Like, it's not like I'm the doctor, I know everything. Here's
Right.
my blah, blah, blah. Here's a prescription. It's more like, all right, what are your goals of this interaction? What are you wanting from it? What is the top concern you have? As doctors, we know that when a patient comes in, sometimes it's not just the complaint that they're needing. Maybe it's reassurance. Maybe it's, something to know about how to accept what they have. Maybe they have a chronic condition that there's nothing you can do about it. So they want so much more than just a prescription. So mindfulness helps you kind of realize your own thoughts, their thoughts, meet in the middle. So that's the first thing, is just being aware and being okay that, hard things are being dealt here. It's okay to show your human side. It's okay to be human.
From both sides. Yeah.
Yeah, from both sides, exactly.
I would realize too is that the more open and present and authentic we are as physicians, we actually get so much more information from the patients, because they realize that we're real, and they realize that they can interact with us. And sometimes you won't ever get to the real reason why someone's visiting you, if you don't give them that door to open, right?
Absolutely. And it goes both ways, like you're saying, that, the patient also needs to understand that, this person is not their enemy. They're not trying to be your boss. They really are there to help you. So if they can be honest with why they're here and try to work towards that from their team approach, and the doctor also realizes that they're not God, they don't know everything, they're working, it's a team approach. So I think that's, really great to do it. In fact, there's a really great book that I'm reading right now that I think all doctors should read. It's called Heal Thyself by, I think it's like Saki Santorelli. He's actually one of John Kabat-Zinn's contemporaries. So, and they kind of train together. So that's, I think, a really good one. It's called Heal Thyself.
Oh, that's great. Put a link to that in the comments when we're done. That would be great. Hi,
absolutely.
Dr. Powell. Thanks for watching.
Hi, Audrey. Thanks for joining.
So, I was thinking when you were talking a little bit about just the description of mindfulness, which I really loved. I haven't actually thought about that, the description of it from Kabat-Zinn for a long time. But so with my weight wellness clients, we talk a lot about delaying urges and decisions, so that you don't, we always make bad decisions in the moment, right? We make really good decisions ahead of time. Right. And so that is the mindset and mindfulness that we talk about, is just sort of realize what you want and just decide you're going to have it in 3 hours from now, right? And wait it out and feel and figure out what those sensations are that you're having. So I really love that.
Yeah, and especially mindfulness can be applied to basically any part of our lives. Mindful eating is a big deal. Even in pediatrics, with the obesity epidemic just rising, it's so important to bring that sense back into being in the present, even with food. So it shouldn't be we're just stuffing our faces or being distracted in eating. It's more that let's look at eating as an experience. So even for my patient, I always say, and for my own children, it's eating, it's another life experience. So let's be present in it. Let's look at the color of the food, the smell of the food. Let's make going to the grocery store not just, oh, here's my list, I'll just pull things. Actually see how it makes you feel. And I think that can be applied to anybody trying to make a change in their wellness or weight as well, by having the feeling, think, am I using food for energy or how it's going to make me feel? Or is it trying to maybe affect some other deeper feelings? Do I feel insecure right now? Is food a comfort for me? And so and the beauty of mindfulness, and then adding a little bit of, sorry, just get a text message, is to be in touch with yourself, accept the thoughts you're going, and take judgment out of it. So I have a big sweet tooth, but I'm trying to be healthy. And so instead of depriving myself, oh, I can't have this. Sorry, another text message. I can't have this. I shouldn't do this. I'm a horrible person. My goals are messed up. It should be hold on. And take a deep breath. No, no, not even that. But take a deep breath and say, okay, why do I want it? Is it just because it's going to make me feel happy? Is it bringing up some hard, memories or experiences in the past? And you know what? Listen to that. If those feelings of guilt, shame, hear it and say, to yourself, be your own friend and say, I hear that. I accept those feelings, but I don't need to let those feelings control me. Then you let it go.
Really beautiful document that I share with my clients about mindful eating that I'm going to post in the comments for everyone, because this is a great conversation. One great tip for people is that eating with chopsticks is a fantastic way of being mindful when you're eating, because you cannot eat as fast as you want to eat. So you don't eat as much, but you also have to like think about each little thing that you're doing and why you're doing it. So that's really great. I want to talk a little bit about little people in mindfulness. Can you? Yeah. So I have little people. I know you do too. You know, I have a just turned 4-year-old and a kindergartner. And so, like, obviously, you know, they're crazy. And we do a lot of, you know, we do some breathing, and we have this great book, these great books from the Conscious Bedtime Stories. Do you know that? It's an Australian writer. And oh my God, look into it. I'll put that in the comments too, because it is just amazing. And they talk about meditation and, like, you know, decision making and all that stuff. But I'm always up for other tips. So let us, give us something for little people. How can we get them to start being more aware?
Right. So I think that, hey Max, I think that mindfulness and being basically mindfulness, let's take that buzzword out. Let's just say awareness. So we can start that awareness really, really young. And that can be as young as, like, I've got a 20-month-old and I have a 3.5-year-old. So Heather, I'm right there with you in the crazy chaos. So the way we can bring the awareness is that first we have to be aware of our own self, right? So, and then help them by verbalizing and showing them what it is that they're feeling. And that can start really young. So when you're preparing meals, for example, say, look at what we're doing. Look at the color of this. Look at the texture of this. Get them hands-on. That's the first step. The second step is tantrums. So that is actually a great time to help them filter these big emotions and be an example to them. Because if we're yelling at them, be quiet, don't yell, stop. Well, what are we doing? We're not being examples. We're clearly not aware of our own stuff. How do we expect this little one who doesn't even have the developmental aspect? Well, we're supposedly the smarter ones. So the best way to do is stop, center ourselves, and say to ourselves first, let's take a deep breath. And I've even, for my kids, like when they're screaming and going crazy, I'm like, okay, mommy's gonna take a deep breath. Why don't we all breathe in? And I do that, and they, you know, they'll end up like laughing or joining with me or whatever. So it kind of changes the mood a little bit. And then after the breathing, realize to myself, you know, they're not here to annoy me. They're not doing it on purpose. They're just kids. They don't know what to do. So once I have that, and sometimes I even pep myself up by saying, you got this, mama. You're a calm mom. You can do this. Then I'll say, all right. I understand. Like, accept them in a non-judgmental way. Please be quiet. You're a bad kid. Shh. No. More like, all right, you know, I understand. You're upset because, verbalize. You're frustrated because I took your toy away. You're angry because you want to watch this TV show that I've turned off. So verbalize. The point is
it gets out of the emotion into more like concrete.
Exactly. Let them know, one, what are they even feeling? They don't know. Are they feeling a feeling, a color, a rage? Who knows? So help them pin down that emotion, and that can start young. So give them a word that they can understand, a feeling, and then a positive way to channel that. So one thing I always tell my kids, even my little one, is that, you know, it is okay to be angry or sad or mad. I understand, but it's not okay to yell and scream. It ouchies mommy's ears. So tell me so I can help you. Tell me so I can help you. And that makes such a difference, because when they feel like you're listening to them, even very young children, they know that you're not their enemy. You're not just trying to whatever.
They feel that.
Help them. Yeah. So it's important to make that verbalization. So wait, is that a word? Did I just make that up? To verbalize.
I got
to verbalize that emotion and feeling, so they have a name for it, what it is, why they're feeling, and how to channel it properly.
Sometimes when my kids are being really crazy, I just lay down on the floor and like don't do anything. Because it gives me that like physical ability of just like, and then they're like running around like crazy, and then all of a sudden they're like, what are you doing? You know, and they have to like stop.
No, the other day, actually, it was really funny that I was having a time where I was just so frustrated about like, my little one was just mad, and she's trying to like potty train, so she's like running around with her diaper off, like throwing her water bottle on the ground, and my other one was just kind of doing her own thing, and I was just like, So I just kind of stopped, and I was just taking a breath. My 3.5-year-old came over, and she's like, "Mommy, just breathe. Just breathe. And it's okay to be mad. It's okay.
Oh, so
Sorry
sweet.
for the baby. It's okay." And it was funny because it was the stuff that I was saying that I didn't even
Right.
realize she was even listening or soaking it in. And here she's telling me, "Mom, just take a deep breath. It'll help you." And I'm like, it is helping me, actually. Thank you, baby.
Great. That's great. So let us know here real quickly where we can find you online and on social media so we can follow along with all this great content that you put out.
Absolutely. So I'm on, well, I've got my blog, first of all. So it's the mindfulmdmom.com. So that's my blog itself, where you can tune in for my content. Then I'm also on Pinterest, Twitter, Instagram, and Facebook, all with the same name. So at the Mindful MD Mom.
Great. And the key to when I always try to look for like at Mindful MD Mom, but it's actually at the Mindful MD Mom. It's a lot easier to get there. Oh, thank you, Maggie. She's like our tech support here.
Maggie is awesome. She's my soul sister.
So thank you for putting that in the comments there. Awesome. So tell us what you're going to write about this week, and then we're going to kind of say goodbye.
Absolutely. So I think this week I'm going to talk about, well, I've got 2 topics. One is how to actually add mindfulness when you're feeling distracted in your life. So some tips on how to be present. That's the first one. And the second one is a little reflection on an experience I had with my daughter about her own self-talk, and how as parents we have such an impact on the inner voice that children start young and continues with us through adulthood. So those are the 2 topics that I'm going to be doing.
I love that, because I talk a lot with our holistic clients about that, the interpretation of your circumstances up to you, right? Like you can choose what thoughts you have about that. So I'm really looking forward to that, and I will certainly be sharing that. And as a reminder, as we close, I'm at www.holisthealth.com and at the handle @holisthealth on most of the social media channels. And also a reminder, like I talked about a little bit this morning, we're relaunching a premium weight wellness program in a couple of weeks with all new coaches, both weight science coaches and mindset coaches, which is really exciting. This is a really transformative 12-week program where you get daily podcast information on weight science and mindfulness, so we can kind of tackle our food issues in different ways, reset our hormones, and get rid of that kind of shame that we have about not being able to figure this out, because there's conflicting information out there and you don't know who to trust. So we're taking all of that away. So
oh my gosh, there's so much information and not all of it's good. So
I know.
Thank you for doing that.
It is. Yeah. And so thank you so much for joining me, and I really loved it, and we should do it again.
Absolutely. Let's do it. And everybody, thank you so much for tuning in and for all the great comments. Looking forward to seeing you guys soon. Bye, guys.
Yeah. Bye.